Anna, and I'm a physiotherapist from Deep Physio. Today I'm going to talk about and teach you guys how to reset your pelvis when you have SIJ issues when you are pregnant, or you can also do this when you're not pregnant as well, to kind of reset the pelvis. So I'm going to do that right now, kind of go through the steps, and you can follow along. So first things first, best thing to do is getting on a mat, a bed, floor, whichever you wish, and then you're going to come here and have a lie down. And then in this lying down posture, you're going to test the legs. So you're going to lift up the right leg and back down, and then you are also going to lift up the left leg. Now my right leg is much heavier, so this is going to be the leg that I'm going to do the treatment on. So first thing, number one, is that you're going to bring your legs up. Bring the legs together and open the legs up so you're stretching the front of your inner thighs. So you can keep the pelvis nice and neutral. And you just hold this posture for about 2 minutes. If you want, you can have actually somebody come up behind you and push into your legs so the legs come into the femurs a little bit more. But we're just basically opening up the inner thighs and getting a really nice stretch. So that's step number one. Step number two is you bring your legs back in together. Legs go hip distance apart, and since this was the heavier leg, this is the leg we're going to do the treatment on. So I'm going to push the leg forward, and then I'm going to pull the leg back. And as you can see, if you can see it, I'm pushing the leg forward, and I'm pulling the leg back, but you'll see that I'm not actually moving the leg on the mat. It's staying still as I push forward and pull back. And that is moving at the pelvis level. So I'm going to do 6 of them. I'm going to do one more. And then to lock the whole thing in, we bridge. So that's step number 3. Step number 3 is squeezing the glutes and lifting the pelvis up, and then bringing it back down. We're stabilizing the pelvis, locking in the adjustment that we just did. That's 2. We'll do 3, and we'll do 2 more, 4, and last one, 5, and then what you do from there is you take the legs back down, and then you retest. So I lift up the right leg, and then I lift up the left leg. Actually, this one is much lighter. This one's heavier now, so I would repeat the whole thing again on the left leg. So then again, step 1, open the legs, hold for 2 minutes. Step 2, slide the leg back and forth 6 times. Step 3, lift the glutes up 5 times, and then you go back down and you retest the legs. Now you keep doing this until both legs feel light and equal, and then your pelvis is now in a better position. So I recommend doing this in the morning as well as in the evening, especially if you have any pubic symphysis pain during your pregnancy or any back pain. Thanks a lot for listening. Bye.